We're back here in Carolina Women. We are here with my friend Dr. Brad Morris, and it's great to see you. I love the name of your company, Integra Vita, and now I know what it means. Share with everyone.
It actually means integrate life. So we call it Integra Vita Wellness. So we're really trying to rebuild everybody's life.
And you really are doing a great job. We were just talking, you know, it's the spring and it's when we really kind of get inspired to make some shifts and changes. And you said you focus on a lot of things, right?
We do.
But a couple of things that you're doing now that you're really excited about.
Yeah, well, you know, being the beginning of the year, we always start with some weight loss.
Yes.
All right, so we've put together a weight loss program that has been phenomenal. We're getting results that I'm even surprised by. So just a 4-month-long program, and it's not hard to do. There's no stimulants, there's no injections, there's no special food. It's just, this is what we really need to avoid.
Exactly.
Right, so I spend more time telling people what not to eat than what to eat.
So this is more of a common sense approach, and it's kind of a lifestyle shift for folks.
It is, and like I was explaining earlier, is at the end of the day, I've got this gastrointestinal tract healed, so that if we do go back to eating the poor choices, that you'll feel it.
You'll know it. Yeah,
you'll
you're
know
going to
it.
feel yucky at that point.
When you're a kid, you don't feel it,
right.
But as you get older, you feel it.
Little interoception kind of thing,
For
right?
sure.
Feeling within my body.
Exactly.
Talk to me about vitamin B, because that's become something that I'm hearing more about, and I know you're really excited about.
Yeah, well, there's a lot of B vitamins out there, but the one that we're focusing on is NAD.
Okay.
NAD is a B3 derivative, and what it does is it restores the mitochondria. And the mitochondria is the powerhouse to all of our cells, and that's what we're made up of, is our whole body's made of cells. So as we age, we start losing the power to the cells. And that's why our skin changes, that's why we slow down, that's why we don't have the energy that we have. So we do NAD therapy here that rebuilds that mitochondria. And I've done it myself, and we've done it on many patients.
Is it an IV therapy?
It is an IV therapy, it is. But when you get done with the loading phase, you feel amazing. And one of the big things for me was the cognitive function.
Oh, I would love that. Tell me a little bit, since I missed my turn here, as we were talking about before, I might be doing this sooner rather than later. Talk to me about how often you would do these infusions.
So the way the NAD works is you have to do a loading phase. So we want to get 5 of those in 10 days. And then after that, we kind of play it by ear, usually once a month after that. And what I noticed was I did my loading phase, and then I was like, about 3 weeks in, I was like, you know, I'm not as sharp as I was 3 weeks ago. So I went ahead and did one.
Okay.
And it brought me right back up. And so I'm at 3 weeks right now, and I still feel pretty good.
Pretty sharp?
Yeah, I'm ready to do another one, but it'll probably be next week, which will be a 4-week mark.
If people are just curious about this, can they give you a call? Can they come in for a consultation?
Absolutely.
What if I don't know what I need? And of course, I'm here with Maria. She's in her 20s, I'm in my 60s. So what we might need and want are probably going to be really different.
For sure. Well, first of all, we do free consults because
there
we got
you
to
go.
figure out what it is you really need. A lot of people come in and tell me things that they want, and then after I talk to them, I'm like, well, I don't think that's going to be the best thing for you. I think that this would be a better place to start. Even with the weight loss people, some people come in that are in a lot worse shape health-wise.
Right, let's get you in,
I won't let them start the weight loss program until they get some other things straightened out.
I mean, I think that's kind of exciting. Talk to me about this. We had talked once before, and I think it's worth mentioning, the ozone and ultraviolet light.
Well, the interesting thing about ozone and ultraviolet light is it's been around since the 30s. It's not new. It has. They didn't marry them until recently.
Okay.
So there was guys in hospitals doing ozone, there was guys in hospitals doing ultraviolet lights. And then the advent of vaccines and antibiotics kind of pushed that off to the side.
Got it.
But in Europe, there's probably 3,000 practitioners, but in the US, there's only about 200 to 300.
Oh, wow.
But what it does is it's going to actually clean the blood.
Okay.
Okay, so then when this mixes back into you, you now have all this super blood going in and repairing viruses and bacterias, fungus, molds, parasites, you name it. Ozone will get rid of anything bad in your blood. We inject it into joints. Of course, we do the IV, and we even do it into cellulite.
Oh, do you really?
We do, yeah, because it will help melt cellulite.
I think the takeaway for today, and I'm big on takeaways, especially talking to you, is that it's probably worth giving you a call, coming in for a consultation. Again, it's the time of year to get healthy, and it's exciting. I love your new office. You're right by Hobby Lobby. It's wonderful.
Yeah, we got lots of traffic here with the new Aldi and Hobby Lobby.
There you go. That's amazing.
Yeah.
As always, it's great to see you. Stay with us. There's more to come here on Carolina Women.